In this video series, we're going to talk about how to write impact letters and the different types of impact letters that, with your therapist, you might decide to write to your son or daughter. Let me first introduce the team.
Hi, I'm Maddie Liebing, and I'm the clinical director. I'm a psychologist and marriage and family therapist and work with both programs.
Hey, I'm Rachel. I'm a primary therapist for the Juniper Canyon program.
Hello, I'm Ronnie. I'm a primary therapist for Juniper Canyon as well.
Hi, I'm Steve Kern. I'm a therapist with Legacy. I am a licensed clinical social worker.
Hi, I'm Sam. I'm a substance use counselor. I'm the infield therapist for Legacy, and I do some work for Juniper Canyon as well.
I'm Jake. I'm also a substance use counselor, and I'm a primary therapist at Legacy.
Devin Nanton, primary therapist and substance use counselor over at Legacy Outdoor Adventures.
Hi, I'm David Weeder. I'm a primary therapist at Legacy. I am a clinical mental health counselor.
And I am Troy Faddis. I am a clinical supervisor for both programs at Legacy Outdoor Adventures and Juniper Canyon. And I'm a licensed marriage and family therapist. Welcome to our video about impact letters. So let's talk about the 4 types of impact letters, or the 4 styles of impact letters. Because impact letters have a long history in treatment programs, particularly in wilderness therapy settings. And over time, they've changed and had variety and have probably improved, but it also is an individualized treatment intervention. It's one of those things that we use to meet the client where the client is at, which is why it's still important for us to understand the different types of impact letters that you might want to write and how to write each one and how to determine with your therapist which one it is that you should be writing. So the other style is a EFT, which is emotionally focused therapy, or an attachment theory style of impact letter. And we often, it's been mentioned before, that a lot of our clients are consequence resistant. And a lot of the reasons why they're consequence resistant has something to do with the style of insecure attachment that they have with other people. And usually what that means is they have a view of themselves and a view of the outside world. And at a minimum, they probably have a view of the outside world as being unsafe and unfair, and they don't trust it. And so when they don't trust it, even if consequences or reflections being sent back at them, they resist that, especially if they have an internal negative view of themselves as well, because then they become really protective. And that's why it doesn't make sense to us what they're doing, but it makes sense to them because they're trying to protect themselves from experiencing more of the pain that comes with shame and all the other painful emotions that they experience, probably on a continual basis. And that's why they push insight away. That's why they push consequences away. And then when they can't do that, they mislabel it so that it's always externalized to be someone else's fault. And so addressing the attachment, addressing that view of not trusting the world and not trusting themselves is part of the point of an attachment style letter, where we're not trying to just do, these are the behaviors, but these are the secondary emotions that we've seen you have in your response to them. These are the secondary emotions that I have had in my response to them. And now I'm going to start to describe in this impact letter the dynamics that we most often get into, where one's usually the person who's going to protest, this is wrong, this isn't okay, we need to do something about this, we need to fix this. And the other person being, I'm just going to avoid and withdraw from this because it's way too intense for me right now because of my insecure attachment style. And that's oddly the same reason why a lot of times we pursue, is that we're insecure as well about this relationship, and our safety comes from fixing it.
Veronica, I know you've used attachment style impact letters quite a bit with your clients. Do you want to address why and how that's worked for you?
Yeah, I can add a few thoughts in here. I think, right, what Troy was saying about the lack of trust of self or trust of the world, right? When we think of trauma, those are two of those crucial pieces that happen. And so we are ultimately trying to build with that person relationship with self and relationship with others. And so this model hits some of the pieces, right? There's still accountability, there's still conversations about past behaviors, but we're looking at it as, okay, let's look at this unhealthy pattern and name that and explore that, and trying to, again, build safety enough to talk about the underlying pieces with it. Can we invite the client to identify, hey, here's right, here's what it feels like when you pull away. Here's what it feels like when you hide in your room. For me, and right, again, imagining how you must be experiencing that. And so it has a similar feel, but I think right, can bring the family into looking at naming those patterns and that cycle versus trying to like blame of like, here's the problem person, or let's kind of add more shame to the family dynamic.
And I think in the process, one of the things that can happen is for the client to really feel seen and heard by the parent, and even vice versa when they do the response to the impact letter. Because I think that's part of where we get stuck in these negative cycles, is that the person, neither one of them feels seen or heard. It just keeps going around and around in this negative infinity of negativity. And when we start being able to drop into identifying the emotions, the secondary emotions, and then even getting, risking enough to reach some of the primary emotions, then people start feeling like they're being seen and heard. And so it really can be an important tool in working on attachment work, and especially for people who've experienced trauma. That's really what they need, is they need that connection, because that is what is affected so much by trauma.
As I wonder if I should talk about trying to bring things down to acknowledge like the secondary emotions, acknowledging the behavior, listing out the pattern that you're seeing, but trying to disclose a little more, and especially for yourself. And you might conjecture what their primary emotions might have been, but at least for yourself, bring it down to the primary emotions here. If you're only talking about, like, I as a dad have felt totally inadequate when I, maybe I'm talking about my reaction to like you getting caught with drugs, and I probably got angry and pissed. Like my first thing was resentment, and I was angry, and my behavior became hostile. I know it became critical. Everything you probably have heard from my mouth since then has probably sounded critical. But the parts I probably haven't shared with you is just how inadequate I have felt. Like when I saw you in handcuffs, or I saw you in the hospital bed, a feeling of inadequacy swelled up in me that I have not been able to let go of since then. And every time I see you use drugs, it renews that feeling, and I have such an overwhelming sense of shame and, quite frankly, just fear. And that's part of what fuels my anger and my reactivity.
And I think, especially for a parent whose child has experienced trauma, there is so much guilt and so much in feeling like I just didn't do my job as a parent to protect my child. That it can, that's some of the primary emotions that we can, if we can get to that and help them be able to understand that, and how much parents beat themselves up over the fact that their child experienced some kind of trauma, and that they weren't there to protect them or to make it not happen. Yeah.
Well, I'd even say, like, us as parents, we feel trauma too. And how hard it is, like when maybe, again, my secondary emotion is to feel anxiety, and my behavior is to become maybe more defensive, or just to become silent and distant. But what's really going on is that I've never in my life has felt more unwanted, or maybe more unimportant. The sadness I experienced every time I see you pull away from me, and I feel so abandoned in our relationship. Like I long for the relationship that we once had, and I wonder what I've done to feel so marginalized and rejected in our interactions together. And it hurts so bad. That's part of why I pull away.
A family I worked with recently and got me thinking about other family systems in this way, but I think everyone is so emotionally needy that the parents are unable to be there for their child. And the child is like, why should I be there for my parents?
Mm-hmm.
And there's just a breakdown in this work.
Mhm.
Well, they don't trust you because what happens when you get stuck in that pattern with each other is you can only have a view of yourself. You cannot view the other person. And so when you're in that moment, like the only thing the parents need is like, I need you. I need you to I need you to meet my unmet need. And there's never a glimpse of, and I also want to be there for you in the needs that you have too.
And it's, I think it's just inappropriate to, one person a parent, one person's a child, and the parent should be going and looking for these things in other adult relationships. And you get a child that's 20 and hasn't had this experience yet, needs to get it from their parent before they're going to be able to give it to anybody else.
Yeah.
Mm-hmm.
And when you have a parent who's unavailable for their own substance abuse, and the child is parentified, then it makes it really difficult to try to get those needs met. But the hard thing is sometimes we can get there, but it's like they have unmet needs and unvoiced needs, and it takes the risk of asking and identifying and naming those things, the reach that they talk about in EFT of what I'm feeling and what I need is scary. And it can be done through the letters, and it can be done in video sessions and face-to-face sessions as well. But it's hard work. And that's why one of the reasons why we recommend that parents get into therapy at the same time as their kids are here, right? Because they have all these things too that they haven't been able to resolve.